Next to report, Lower Fairfax Health District, Mr. Greene. Dr. Greene, I'm sorry.
That's about right. And I am Dr. Colin Greene, and I work for the Virginia Department of Health. I'm the health director for the Lower Fairfax Health District, which serves not only Warren County, but also Page, Shenandoah, Clarke, Frederick, and the City of Winchester. Mr. Stanley asked me to come by and give a briefing on measles, because we've turned up a case of it in Virginia, and there have been some discussion. Bear with me while I figure out how to work this. Strike one. All right, what am I doing wrong here? Okay. So briefly, people wonder what the public health director does and what public health is. We're a state agency of the Commonwealth, and our job is to protect health and promote well-being. One of the ways that we do that is health education and discussion, which is what I'm doing this evening.
Okay.
All right, which of these buttons should I be pressing?
Go to the right arrow and aim at the laptop.
Oh, even at the laptop? So that's, all right. Earlier this month, Virginia turned up the first case of measles of this year. It was an unvaccinated traveler who had been overseas in a part of the world where measles is much more common. The traveler returned through Dulles Airport on the 2nd of June. The diagnosis was made a couple of days later. As soon as the Department of Health had the story together, we put a press release out on the 6th of June. That person, to our knowledge, did not travel in the valley at all, so has not exposed the Warren County area. But nonetheless, Dulles Airport is just so far away. So, how many people here have actually seen a case of measles ever? Anybody had it?
Had it?
Yeah, okay.
If you have gray hair, you've seen.
Yeah.
Snow on the roof.
Well, I will tell you that I'm 60 years old. I've been a family doctor since 1987, and I've probably seen 3 or 4 cases of measles in my entire career. It was not a common disease for a very long time. Unfortunately, that's changed. So measles is caused by a virus. It's extraordinarily contagious. 20 minutes in a room with someone with measles is enough to pass it on to a susceptible person. The incubation period, which is the time between when one is infected until the symptoms show up, anywhere from 1 to 3 weeks, 7 to 21 days, typically about 10 days. Measles makes you sick as a dog. Much more so than most other diseases. Fever of 101 up to 105. And in medicine, we talk about 3 C's: cough, coryza, and conjunctivitis. Coryza is just a runny nose. So cough, runny nose, and red eyes, it's essentially a case of the flu on steroids. It comes on like a really bad cold, really bad case of the flu. 3 to 7 days later, the rash shows up. Flat red spots starting at the face. It spreads north to south, and afterwards it clears north to south. By the time the rash is there, the person has been contagious for 4 days. So you can see that you might just think somebody has a bad cold or a case of the flu, and all of a sudden the rash shows up and you go, uh-oh, where's this person been? So that's the way it used to be with the measles. Again, the patient gets miserably sick with it. 4 days before the rash shows up until 4 days after, very, very contagious. By the time the rash is fading, the person is really not contagious anymore, but the opportunity to spread it has already occurred. Measles is an ugly disease. Probably about 1 out of 1,000 people that get it will actually die from it. Another 1 or 2 will get a serious consequence, the worst being encephalitis, which can cause permanent brain damage. Up to 25% of people that get measles can be hospitalized. So it's certainly a whole lot of lost work time for not only the patient, but the caregivers as well, and a lot of significant personal discomfort. So in 1950, that's before I was born, there were 319,000 cases of measles that were reported in the United States, and about 100,000 died, so 468 deaths were reported. Vaccination became available in the 1960s and was widespread by the following decade. By the year 2000, we actually declared that measles had been eradicated in the United States. The few cases that did exist were all brought in from other places. Well, that didn't last. Unfortunately, right about that time, just 2 years before, in 1998, a physician named Andrew Wakefield in the UK came out with an article linking the MMR vaccine to autism. That particular article was later proven to be fraudulent. The journal withdrew it. Dr. Wakefield lost his license to practice medicine in the UK, but the rumor will not die. It will not go away. And unfortunately, a lot of people have chosen not to get vaccinated against measles and face this disease that they don't need to face. By 2010, we had 68 cases. This year, as of 13 June, we've had 1,044 cases. That's the first time we've had over 1,000 cases of measles in the United States since the late 1980s. So we just hit a 30-year high. We're fortunate that we've only had the one case in Virginia right now, although between the time I made this slide and this evening, I understand there's a possible second case. Again, not here in the Valley, but elsewhere in the Commonwealth. So why does it come back? Some people aren't getting vaccinated for various reasons. And the reality is that 2 MMR shots will give you lifelong immunity to measles. And MMR absolutely does not cause autism. There have been any number of studies that have been carried out since that original fraudulent study that have shown again and there is zero link between MMR and autism or any other immunization and autism. No connection, zero. So what should you do? We've got a case in Virginia. Is it a threat here in the Valley? Well, if 21 days go by and none of the contacts of that child, adult, has turned up with measles, we're all off the hook from that case. But there will be other ones, and there are cases in other states. So, if you were born before 1957, and there's probably a handful of people that fall into that here, you were assumed to have had measles or been exposed to it and are probably immune. If you were born after 1957, that's me, 58, and you've had either a documented case of measles or you've had at least one measles-containing shot, you're presumed to be immune. Or if you've had 2 of the MMRs, which is probably most everybody who's younger here, or if you've had a lab test that shows immunity. Any of those, and as a civilian person, you're safe. Now, if you're a healthcare worker, the bar is a little bit higher. You have to either have had the 2 MMRs or you have to have the lab test showing that your antibody level, the so-called titer, is above a certain level to show you're protected. All right? So, if you're immunized, you really don't need to worry about this. So what if you think you've been exposed? What if you're not immunized for some reason you think you've been exposed? Again, if you're immune, nothing to worry about. If you're not, you need to go see your doctor. Depends how long the exposure was, how severe the exposure was, and whether the case that you were exposed to really was a case of measles. What if someone thinks they have the measles? Well, number one, stay home. Stay away from other people. Get a mask so you're not breathing or coughing on people. And then call your healthcare provider. Call first, and then go in and get seen. But make sure they know a possible case of measles is coming in so they can prepare. Again, extraordinarily contagious. If you're going to go to an urgent care, go with somebody else and have somebody else walk in first and say, I think I've got someone with measles in the car. They may send you to the emergency room. If you go to the emergency room, have that same person walk in first and say, I think I've got a case of measles. And they'll send a nurse out and they'll take you to an isolated area. Again, most people should not be susceptible. It may be that nobody in this room is susceptible to measles. But if you have a community of people where, say out of 10 people, 4 or 5 of them are not immunized, that's enough to start spreading the disease around. If you have questions, call the health department. And again, just to put it in perspective, measles is a bad disease. Used to cause a lot of misery. We got rid of it, or almost completely got rid of it. Now it's coming back because, number one, there are people that are not getting immunized, and number two, it still exists in other parts of the world. We haven't eradicated it yet, not even close, so it's still out there. So that's the bad news. The good news is this is measles, it's not Ebola. Okay, so 1,000 people get measles, 1 person dies. 1,000 people get Ebola, about 700 of them die. So this is not a disaster, it's just something that we need to control. And again, the thing to do is prepare, and the main thing is make sure you're immunized, and then know a little bit about the symptoms, the incubation period. And if you have questions, if you think you're sick with it, call first. Don't just show up in the emergency room. And if you have questions, call the health department. Right over here in town, you can stop by, 465 West 15th Street, or call that number on the screen. What questions have you got for me?
I have one. If I had measles and I'm immune,
Yes, ma'am, you had
Thank
it.
you.
That's it. You're good.
thank you.
Doctor, thank you very much. We appreciate that.
Glad to do it. I'll hang out over toward the side if anybody wants to ask any other questions offline. Thank you.